working here as a volunteer is a good way to get to know your community. It's a good way to learn how to work as a part of a team, and it's a good way to meet some really wonderful people. Learned a lot from the other volunteers and from the staff coming through here about production techniques. I'm Ken Grant, and I'm a Rogers TV volunteer.
At St. John Ambulance, we're all about community. We teach life-saving skills and provide community support through our volunteer services. All St. John Ambulance product sales and training registrations support these important services. Volunteer, donate, or enroll in a program today so we can continue to have an impact on our community. Visit sja.ca to learn more. At St. John Ambulance, we do more than save lives, we change lives.
This is Rogers TV.
Hello and welcome to this special edition COVID-19 Rogers Television program. My name is Carol Merton, and before I welcome our guests today, for those of you who watch the program regularly, you know that I like to take a few moments at the beginning of the program to say thank you. So today I'm reading some excerpts that have come to me from a letter from a writer, Alison Wines. This letter actually was sent to me through Francesca Dobbin, the Executive Director of United Way, Bruce and Gray. So these are some excerpts, and then I'll add a few comments at the end. There is an invisible group of people who aren't being recognized, who are working intensely to keep the world turning, to make sure that those on the front lines have the support they need, and those at home have something to go back to when we get to the other side of this. Who are you? You're the HR teams working 80-hour weeks to start workforce planning from scratch, redeploying team members and trying to think of something, anything, to preserve jobs. You're the CEOs of charities writing new budgets so you can keep helping the world with funding that has evaporated overnight. You're accountants and bankers restructuring finances and debt to help small businesses stay afloat. You're trade managers negotiating frantically to get hand sanitizer and face masks into our country. You're consultants supporting clients through massive change, unsure if you will get paid for the work that you're doing, but doing it anyway because it matters. Your hospital administrators running payroll for the nurse that just clocked 30 hours of overtime. Your communicators trying to find the words to explain a crisis the likes of which has never been seen to your organization's staff and to the community. My words to you are this: you are not invisible. Our message back to you is your contributions are greatly appreciated. We are sending to you a most heartfelt and sincere thank you for all that you are doing. And on that note, I also want to thank our guest today, who is joining us to talk about rural resilience. That's a tongue twister for sure. Ashleigh Weeden. Ashleigh, thank you. And I know you're going to introduce yourself even more in a moment, but my understanding is that you are a PhD candidate in rural studies in the School of Environmental and Rural Development. And that's through the University of Guelph. Do I have that correct?
Correct, yes.
Thank you for joining us in the program today. And, you know, I've had the lovely opportunity of reading some of your information, watching you on YouTube, I think, which really piqued my interest about looking at rural survival within the COVID-19 world. So tell us a little bit more about yourself, and I understand that you're also involved in research.
Great. So thank you for having me. I really appreciate creating the space to have this conversation today, and the framing around rural resilience certainly speaks to the longer arc of my work. So I think the things that we'll talk a bit about more today have to do with the ongoing tensions in cottage country, but the span of my career and my research is much broader than that. And some folks that might be viewing this, I did live and work in Grey County for a number of years before going back to pursue my PhD. So I worked for Grey County, and I helped steward some of the Connected County initiative that resulted in us being recognized as one of the top 7 intelligent communities by the Intelligent Community Forum. So folks might have gotten used to me through hearing that. And before that, I helped steward the new brand there when it was first announced. So people are probably in your catchment area used to seeing me around. But in 2017, I went back to school, largely based on a lot of the work that we were doing through the Connected County Initiative and through the Swift Broadband Project, with these questions around what does rural innovation specifically look like? What does a rural future mean? And a lot of that stemmed from a frustration of not seeing certainly the places that I've called home or loved throughout my entire life represented in broader public policy and discussions. And so over the last, I guess, 3 years now, my research at the University of Guelph has been largely focused on this notion of specifically rural futures. So I call myself a rural futurist, which is a little bit tongue-in-cheek, and was designed as a little bit of a callback to a lot of folks that tend to dominate the way we talk about futures as being quite urban and the age of cities and all this stuff. And my thought was like, well, wait a second, there's more to Canada than Toronto, Montreal, Vancouver, and how do we tell those stories? So what's been coming out lately in a lot of these questions, and I think that we're starting to wrestle with in very perhaps more tangible ways than many people are used to directly dealing with, is how do we talk about this conversation of rural and urban, or rural-urban linkages, not rural versus urban, but how do we have different conversations about the way we take care of each other? And certainly the COVID-19 crisis and the pandemic is not revealing new problems, but is exposing all of the ways in which our systems were already fragile or had fault lines that we can't ignore anymore. So a lot of the questions that I think probably piqued your interest around this conflict between seasonal property owners and year-round residents in rural areas, people kind of roll their eyes and think, well, aren't there, more important things to be talking about right now? But when it comes down to it, the questions underneath of those issues are really human issues around how we value different places and value each other.
For sure, and I know you're going to be discussing that tension and a little more, but I found it fascinating that you refer to the rural environment as a delicate ecosystem, and I had never heard that in relationship to a rural community. So I'm going to leave it with you to explain that for sure, because that really piqued my interest.
Well, I think we're certainly used to talking about our natural ecosystems
Yes.
and around how our environment works and our interactions with those pieces. And we know that if you can tug on, in research, we call them wicked problems. So if you tug on one aspect of a ball of yarn, it tends to create a bigger tangle. There's no right or wrong answer. It just creates other spillover effects. So you're always kind of trying to figure out, if I pull on this, what happens? And ecosystems are very similar to that, right? In terms of, if we touch kind of one aspect of a system over here, it'll have spillover effects elsewhere, often that we maybe don't intend or haven't thought about, and we need to be kind of cognizant of what might happen when we do those things. And when we think about rural communities, I think in particular in relation to the pandemic, we're seeing the ways in which these interconnections are really tightly woven. And how, we all witnessed the devastation, certainly in Bayfield with the outbreak at the care home there, and how there seemingly wasn't a single person in that community that either didn't have a relative in there, didn't work there, didn't have somebody connected to that care home. And when we talk about the ecosystem of that community, everyone was touched, even though you could say that it was an institutional outbreak. And when we talk about broader systems in terms of community, the interesting part to me about rural places is that our decision makers often wear multiple hats. So you might sit on city council, but you're also a local business owner, or you might be part of the library and also be on the hospital board, or you volunteer with the Lions Club and your kid is in high school, and all of these kinds of things. Everything is layered perhaps much more deeply than it might be in larger cities where you might be more disconnected from each other. And so we're seeing this play out not only in terms of our relationships to each other as individual, but our relationships to the core kind of pillars in our communities. So, if the local grocery store is out of a particular product, then everybody's out of that particular product because you might not have another store to go to, and so on and so on. So these interesting kind of pieces around them that we need to be thinking of more and more. And I think broadly what a pandemic, when the crisis is not purely physical or economic and it is related to health, we're seeing how tightly woven our systems are with each other and how important it is that when we think about our individual actions, they have an impact on the broader system of our community and then the broader system of our more global community as well. So, one person does one thing and you might think, oh, this is my personal choice and I'm being careful or I'm doing this particular thing. But if you aren't quite as careful as you might be, or if you take maybe an unnecessary risk thinking that it only affects you, what we're seeing play out in real time right now is that that's not actually true. And that's the case of a broad variety of things, whether it's environmental, economic, everything. We're just experiencing it much more directly because it's health related now.
So I had sent you some bullet kind of questions and points. So I may just go to a few of those, but you can digress and add things because you're the expert. I'm just asking the questions. So based on, the impact of what one person does to another, one of the bullets was that visiting cottages, camps, vacation homes are a Canadian summer pastime. However, during COVID-19, people usually traveling to and from their cottages or coming to the cottage to escape the city has been a common occurrence in spite of the restrictions. Why is this happening, and why is it causing a concern in rural communities?
Yeah, and I mean, as you've probably already guessed, I like to talk, so it's no problem for me to
this is good.
And I think so. I want to be very careful. I'm not the moral authority on these kinds of questions, but I do have, based on my own experiences, lived experience of having lived and worked rurally and continuing to live and work rurally, and I have some skin in the game. We have a secondary property on Saugeen First Nation, but I also live with very at-risk individuals so our decisions are balanced around these kinds of things. But when it comes to this tension between the disruption in our lives, right? So the desire to go to your cottage or in other parts of Canada, a cabin or to a second property, everyone is looking for a release valve. And I think that there's some interesting tension here. So we are, just under 3 months into this. It's not as if we've been battling this for decades. So we need to be aware of the degree to which impatience is being cultivated in us rather than, I think we maybe culturally and individually have the ability to tough it out a little bit longer than we might be, because no one is saying that local leaders that are asking people to stay home for now, no one is saying you'll never come to your second property again, and not even this summer. They're just saying let's hold out just a little bit longer until it's safer for everyone. And while there might not be a federal or provincial kind of blanket ban on going to a secondary property, and certainly there's been a lot of confusion from kind of other orders of government. People are seeing a kind of a do as I say, not as I do behavior from some of our political leaders. People are getting fuzzy instructions from the people we perceive to be authorities in terms of whether it is okay or not. And then on the local level, you have a number of, whether it's a First Nation that leases land or an individual community, instituting both hard and soft barriers. So, for instance, in Norfolk, for a time being, there was a hard order from their medical officer of health saying, secondary property owners will be fined if they come to their property for recreation purposes. Saugeen First Nation, for example, has closed its borders to protect its community for the time being. And then you have kind of softer requests from local communities saying, please just for now, unless it's an absolute emergency that you need to come to your secondary property, please stay home. And here are the reasons why. Our local healthcare capacity in small and remote and rural communities, we know that they're limited. If you've had to have surgery, or if you've had a broken bone, or if you've had any other emergency in your life, and you've gone to a local or small town hospital, when things get really serious, they tend to ship you out to a big city, right? Or in the case of an ICU capacity, we've seen incredible innovation in places like Perth, where a doctor early on in this was able to find a way to make one ventilator serve 9 critical care beds. But that's kind of almost field medicine approaches to things. You may have a respirator, but it might be an ambulance respirator rather than a true long-term ventilator. And so there's all these interesting capacity questions around long-term disinvestment in rural healthcare capacity. And then you have this interesting question around the local kind of supply chain. So rural communities, just like their urban counterparts, are struggling to deal with interrupted or challenged supply chains the way that everyone is, and so the toilet paper run, or the latest one is around, flour and yeast, and nobody can seem to get their hands on those. And, small town and rural communities are dealing with the exact same challenges that urban ones are, except that the ability to spread that strain over multiple different outlets is a lot less. The third capacity being, there's an immediate and long-term cost to asking people to stay away. And I think that often, and certainly lately, a lot of the counter arguments to people wanting to go to a seasonal property during a global health crisis has been, well, local businesses depend on my investment in the community, and certainly many rural communities have become quite seasonally based. However, that's not really news to local community leaders. When they're asking people to stay away, this is not a decision that's being made lightly. And so I think there's sometimes an assumption that people are telling rural communities something they don't already know. And we're having this complicated discussion right now around, well, you can go to your cottage as long as you take everything with you and you choose to isolate. But that doesn't help anybody either, right? So you're overbuying at home, and you're going to strain your local resource system by kind of stocking up and hoarding the supplies you're going to need for the time period that you're going to be away. And then you won't be injecting your money into the local community that you're going to. So that argument falls apart a little bit on closer inspection. But we are seeing the consequences of not having a release valve and of rules. So in the case of this past weekend in Toronto with the crowds at Trinity Bellwoods Park, or in terms of people needing some sense of normalcy, right? Like, this is hard. It's hard, and it's human, and it's really not a fun experience for anybody. And in the absence of sort of a yes or no, we're all looking for, well, no one told me I couldn't do it, and if I'm really, really careful, then it'll be fine, rather than thinking about, I have the opportunity right now, probably more so, certainly in my lifetime, than I've ever had before, to really take really good care of other people by simply choosing to stay home a little bit longer. And, going back to that earlier question around the little bit of the eye roll around, really, are we talking about seasonal property owners right now? Like, this feels like a little bit kind of an issue for those with immense privilege, and I think arguably it is that, in the context of people who haven't been allowed to gather to grieve loved ones, or who have canceled weddings, or who may be, struggling and making minimum wage and putting their lives at risk every day, it's easy to see why it's hard to garner sympathy for folks that are a little bit angry about being told to choose a residence just for the time being when they have multiple. So there's all of these kind of complicated layers around equity and equality and privilege, and kind of how that plays out in a structural way. And then also all the messy human bits, right, around it's hard, and this is another thing I have to give up, and I feel invested in this community, and how do I balance my own needs against the community's needs? So it's thorny, to say the least, and I think there's a lot more to it than what's on the surface.
For sure. So there's a bit of an entitlement attitude for those who have multiple residents, that they are, they pay taxes, or they pay, so they should be entitled to go. And your point is, but it has an impact both in their home community as well as in their rural community, that there is an impact. You've used the term, and I'm wondering if you'll discuss it a bit more, rural gentrification and disaster gentrification. Those are big words. What do they mean? Help me understand those big words.
Right. Well, I mean, so we're academics, right? We love nothing more than to throw words around as if they're nothing. And so, and I want to be careful. There's this question around entitlement, and seasonal property owners are not outsiders. Like these not invaders. Are often, I think of myself. We have a multi-generation connection to the part of the world where we have a second property. My dad's originally from, kind of the Paisley area. For me, that's been home to me for my entire life for half the year, and it's still what I consider home in my heart kind of thing. And so the feelings of entitlement, whether they're based on property taxes or based on investment, are sometimes justified, but it's how we enact those. So in my things, I think of if I truly love these places the way that I say that I do, what's the best choice that I can make to take care of those places, and how do I think about those things? And the property tax question is really interesting because municipalities do what they do for us on 7 cents of every tax dollar that's collected in the country. So municipalities provide all of the things I say, like the top and bottom of the hierarchy of needs. So the things that make life possible in terms of like water services and garbage and emergency services, as well as the things that make life nice, like arts and culture and our community services. And they do that on like about this much of the overall tax bracket in the country. And so we have to be really careful when we think about, will I make this possible through my property taxes? Well, that's just a fraction of the operating costs of making sure that the community is able to sustain itself. And we need to have a different conversation. That's a whole other can of worms. But when we talk about the rural gentrification and sort of disaster gentrification, that's part of it. So who has the ability to go to a second property during this time? Who has the ability? So, and it's not just kind of Justin Timberlake going to a ranch in Montana, which is kind of a nice figurehead for this, but it is a case of the people that have the luxury to work from home are often higher income earners or white collar professions. And those are often the kind of conversations of the parts of the world or parts of the professional world who are talking about, if working from home becomes my new normal, then why wouldn't I do that all the time? And then I can go and live at this property year round. And typically, we might see that as a boon for rural development, right? Because our model of rural development right now is urbanization. We say more people should come, more amenities should be built, and we should be seeking these kinds of things to move forward. And to a certain degree, that's great. But what are they replacing? Who's being displaced in these issues? So when we talk about gentrification, we're talking about things like Brooklyn, right? So, previously seedy part of New York City, it was found to be affordable by young creatives and young professionals. And so then it became progressively more and more a place for young people wanted to be. And then that drove up kind of property values or like rent values. And you get this cycle around, okay, well, then the people that were there before get pushed further and further to the fringe. And so that's the gentrification, like the gentry come out, right? And then when we talk about disaster gentrification and rural gentrification, we're seeing this trend happen, whether it's in response to this current crisis of the pandemic, or in response to things like hurricanes or other natural disasters, and certainly as climate-related disasters become more frequent, people looking at rural areas as somewhere safer or somewhere that I can be in a different place. So in terms of disease, and I mean, there's no concrete evidence that density and disease go together. It has more to do with structure, with the inequality within these systems than it does the actual density of people. But people's minds kind of go to, okay, well, there's outbreaks in Toronto and Montreal. Those are big cities. My safer bet is to go somewhere smaller. And if I can afford to do that, then I should do that. And that's kind of our human lizard brain rather than the true evidence behind those things. But it has consequences for the communities that are already there. And part of those consequences become, we talk about people that are in rural communities as if they're just part of the landscape. So we say somewhere rural as if it's not already occupied by people in a whole community and a structure that's been there for a long time already. It's just sort of this empty space where people should go and fill it with something, which, living in those communities, I kind of take a little bit of umbrage to that. I don't need to be built on top of. And so I can understand people's, reaction to that. And in the same breath, we do need people. Rural development for decades has been predicated on locate your business here, build your life here, come here. But we do need to think really carefully about in the context of who has the resources to do that, who has the sort of the privilege or the ability to make those decisions on behalf of themselves or their families, and who are they going to displace when they get to those communities, and how are we going to support people that are already there that will, to make sure that they're not pushed further and further into marginalized positions themselves. So it has all of these cascading results, so we go back to the very first thing we were talking about in terms of the systems view of things is views, if I put my foot down on this particular squishy bit of the system, what's going to happen over here? How is it going to kind of bubble out, and how is it going to affect other things, and what's going to happen as a result of that?
Yeah. Now, I know that in one of the articles from the group, it had talked about the group had found that rural residents are concerned about how their communities will survive the crisis. And you mentioned that while urban area centers face many of the same job losses, these challenges impact rural communities differently. Can you talk a little bit about the difference?
Right. So, a really interesting thing that's coming out of the current recession responding to the COVID-19 crisis is that some scholars are calling it a she-cession. So the job losses are more predominantly affecting professions where women work, or care work, service, education, retail, versus sort of the harder things that we've looked at before in terms of jobs typically that we associate as being male-dominated, around construction, oil and gas, those kinds of things. And they've certainly been affected, but when you look at the breakdown from reports from Statistics Canada, the layoffs have not been as severe as they have been in hospitality or in care or any of those kinds of professions. We further have, when we layer that in a rural setting, the hits become even harder because we've had a sort of several decades now where rural communities that have been in transition, who may have lost a historically major part of their economic sector, so whether it's manufacturing or some sort of resource development, and are transitioning away, have used tourism and seasonal tourism as a way to make up for that. So they've said, okay, if we no longer have manufacturing, then we'll market ourselves as a destination. Well, we now have a crisis where you can't travel, and the means by which we would normally address a recession. So critically, a really important part of this is the way in which we typically get ourselves out of these circumstances is by putting people to work and investing in public infrastructure, and through massive public projects. However, when it's a health crisis, we can't bring people together in those kinds of way. Further, like the meat packing process plants happen to be in rural areas, and we're seeing the consequences of sort of the geographic distribution of labor. So we need to think about how that plays out in terms of rural policy.
And for me, that's really helpful to understand. I know we're on our last minute of the program already. I could talk to you for hours. I want to thank you for being on the program. I think you've really brought a light for me for sure about the difference, and to think of the rural community as an ecosystem. I want to thank you for arranging your time today, because I know you juggled a variety of things, and I'd love to have you back on the program again anytime. So thank you, Ashleigh. And thank you to our viewing audience. I want to express a sincere thank you to the viewing audience who are tuning in to learn more about resources and services available. Please join us again. Take care, stay safe, and care for each other. Thank you.